As a nursing team, we have identified that the most important actual problem for Mr. Vale is that he is anaphylactic to his prescribed antibiotic Augmentin Duo 4. This is due to it containing two active ingredients, with one of them being amoxicillin, a derivative from penicillin, which binds to penicillin-binding proteins. This was brought to our attention as his medical records show that as a young man he had anaphylaxis to penicillin, which has not since been re-challenged. Taking into account Mr. Vale's age and best health interests, we believe it would be impractical to re-challenge this adverse drug reaction, as he is 78 years of age, and there is an alternative option. We believe that the doctor should prescribe a new antibiotic such as cefadroxil, as it does not contain any penicillin or any other ingredients that may cause Dennis to have an anaphylactic reaction. We suggest monitoring him quite frequently when administering the new antibiotic to ensure no drug adverse reactions.
When considering Mr. Vale's simvastatin use in conjunction with his renal failure, it increases the risk of myopathy and rhabdomyolysis. The AMH recommends starting at a low dose in the elderly and monitoring signs and symptoms. We would like the doctor to review the appropriateness of this medication. Although Mr. Vale is on ramipril for his hypertension, he appears to still have high blood pressure. We recommend the doctor add a calcium channel blocker or a thiazide diuretic to lower his blood pressure to 140/90 or below.
The therapeutic plan we recommend involves the following healthcare professionals. Firstly, we suggest the doctor to review his antibiotic and medications that are making his renal failure worse and the changes to the other drugs previously mentioned. Secondly, we strongly suggest he consults with a diabetes educator along with a dietitian to ensure he is informed on the importance of managing his diabetes appropriately with a balanced diet and exercise. If he complies with this, it may be enough to control his diabetes without the use of metformin, which is a contributing factor to his renal impairment. Seeing a psychologist is the next priority, as the passing of his wife has contributed to his unhealthy lifestyle choices, with his depression being a potential problem. This is an issue we need to resolve. We believe Mr. Vale needs a home medicines review to ensure he is taking his medications adequately and to see if the dosage is appropriate.
Along with other healthcare professionals already stated, we recommended he see an optometrist and a podiatrist, which will contribute to a better health outcome in regards to his diabetes, as well as a referral to a urologist to review his renal impairment, and as he is reluctant to take his medications, we suggest he see a pharmacist to either stress the importance of taking the antibiotic or implementing strategies that are non-medication related.
The potential therapeutic problems for Mr. Vale are his ibuprofen, food and alcohol intake. Mr. Vale is currently taking 400 milligrams of ibuprofen, 1 tablet 3 times daily when needed. Ibuprofen is a non-selective, non-steroidal anti-inflammatory drug. This drug is used to treat pain and reduce inflammation. Dennis is currently consuming 1200 milligrams of ibuprofen per day. Whilst he's still under the threshold for the maximum dosage of 2400 milligrams daily, he is still at risk of adverse effects and damage to his renal function. Australian Medicine's Handbook states that the most common effects are nausea, dyspepsia, GI ulceration or bleeding, raised liver enzymes, diarrhea, headaches, dizziness, salt and fluid retention, and hypertension. There are also interactions with ibuprofen and other drugs Dennis is currently taking.
There is a major interaction with ibuprofen and aspirin. Regular use of ibuprofen can reduce the effectiveness of aspirin. Combining these medications together can also increase your risk of developing gastrointestinal ulcers and bleeding. Dennis initially experienced terrible stomach aches and some diarrhea. This major interaction of his medications could have been the cause of this. There is a moderate interaction between ibuprofen and ramipril. Combining these medications can reduce the effect of ramipril in lowering the blood pressure. Both medications can also affect kidney function, especially when used together. An alternative to ibuprofen is paracetamol. Dennis could stop taking ibuprofen and replace it with paracetamol. The appropriate dose for Dennis is 500 milligrams to 1 gram every 4 to 6 hours, with a maximum dose of 4 grams daily.
Dennis is currently experiencing signs and symptoms of kidney damage, such as his sudden weight gain of 10 kilos within 3 months. Mr. Vale has a medical history of hypertension and type 2 diabetes mellitus. Both conditions can be affected by diet and exercise. His current diet compromises mainly of fast food or instant prepackaged meals. He also states that he likes to eat 2 to 3 bananas every day. One medium banana contains 422.4 milligrams of potassium. If he consumes 3 bananas, that's a total intake of 1,267.20 milligrams of potassium. The serum potassium normal range is 3.5 to 5.3 millimole. Dennis's level is 5.8 millimole, which is considered to be hyperkalemia, also known as high potassium levels. His alcohol consumption is 2 or 3 glasses of red wine every night. According to Diabetes Australia, alcohol may increase the risk of hypoglycemia. Current guidelines recommend no more than 2 standard drinks a day for both men and women. Therefore, Dennis needs to reduce his intake of alcohol. Since the passing of Mr. Vale's wife, he has become quite isolated and not motivated to care for himself. Therefore, his health and functional status has declined. We recommend referring him to either a social worker or a psychiatrist to assist in monitoring his mental health.
In summary, the available options to resolve the issue identified are take him off ibuprofen because his renal function is damaged, swap from Ramapril to another blood pressure lowering drug, take off aspirin and Nurofen and change him to paracetamol, increase exercise, walk at least 30 minutes per day, reduce consumption of bananas, change diet and organise specialised diabetic friendly meals to be delivered to his house, monitor weight and aim to reduce weight, monitor blood pressure and blood glucose level, reduce alcohol intake and allow him to have 2 glasses of red wine a night maximum, and refer him to a social worker or psychiatrist to review his depression.